Hello, everyone, and welcome to part one of our lecture on chapter 14, the assessment of interpersonal relationships. So, in this first part of our lecture, we're really going to focus on the different assessments that can be used with couples and families, as well as some assessments for intimate partner violence. In the second part of our lecture, we will cover some very specific parts of assessment of interpersonal relationships regarding abuse and genograms and how those show up in the work that we do as clinicians. So let's get started by jumping into the assessments of couples and families. The assessment of couples requires a counselor to examine multiple relationship dynamics and interactions, as well as providing an opportunity for you as a clinician to triangulate information from multiple sources in the process of the assessment. So, when you're conducting an assessment with couples or with family members, you are getting so many different perspectives on the same presenting concern or whatever is bringing that group into counseling. And it's your job as a counselor to navigate all of that information. And though these assessments can be helpful not all though, but these assessments are helpful in determining the functioning of a couple or a family. They really give us insight into what it's like to be in that family dynamic or in that relationship dynamic. And the literature indicates that formal assessment inventories are minimally used in the counseling process, but when they are used, there are 10 prominent common inventories with which counselors should be familiar. It's also important to keep in mind or to exercise caution because most of these assessments were demonstrated and developed using white middle-class couples. So the applicability and generalizability of these assessments are pretty limited. So as a counselor, if you are choosing to use one of these assessments, you really have to use your judgment and use some caution on who you use them with. And then in addition to the more formal measures of personality assessment, as counselors, we should also consider using informal measures such as observation and interview protocols, as well as self-monitoring methods and genograms, to name a few. And we'll go into a little bit more detail on what some of these look like in the second half of our lecture, but don't discount the role of informal measures because, as we know based on the research, formal measures of assessment of formal assessments of couples and families are not used very regularly because these informal measures tend to be more applicable in the context of counseling with clients who are part of couples and part of families. So using things like how you're observing the interactions between the different family members, changing the questions that you ask your clients during the intake and even just during regular sessions, as well as helping them to engage in self-monitoring tools, and you as a counselor using tools that are available to you to better conceptualize what a client or what a couple or family is experiencing. So let's go into a little bit more detail on the 10 different available inventories that tend to be used with couples and families. The first of those we've actually already talked about. It's the Myers-Briggs Type Indicator, which, as we mentioned already, is a measure of 4 personality dimensions. And this particular assessment is helpful in the use with couples and families to help individuals understand their communication patterns and the preferences that they have for interaction and decision making, because sometimes the differences between what one member of a couple or a family is experiencing can be different from what the other members of that couple or that family are doing, and those differences can lead to conflict. Also, sometimes counselors will have the clients complete the Myers-Briggs twice, once for themselves and once for how they think their partner would respond, to highlight how the couple sees differences affecting their relationship. But also keep in mind, as I mentioned in our lecture on chapter 13, that the reliability and validity of the Myers-Briggs tends to be pretty low, specifically the test-retest reliability and the construct validity of the Myers-Briggs are quite low. And if you are using the Myers-Briggs with couples and families, those limitations are multiplied by the number of people in the relationship. So keep that in mind if you're planning to use this or you're thinking about using this with a couple. And also be upfront with the partner or with the people that you are using this with and telling them, yeah, here are the limitations of this assessment. Do you want to continue? Let them give you consent. We also have the Taylor-Johnson temperament analysis, which is a tool that is commonly used in premarital counseling and investigates the relationship and personal adjustment factors within a relationship. Specifically, there are 18 traits that are measured on 9 bipolar scales. Some of the examples of those bipolar scales might include nervousness to composed, depressive to lighthearted, responsive to inhibited, and dominant to submissive, and self-discipline to impulsive. And the scores that someone receives on the Taylor-Johnson are oftentimes compared among members of a partnership or within family members to really help to see how that person is sort of adjusting in their lives, both personally and to the relationship, and looking at if there are differences and similarities across the members of the group. We also have the marital satisfaction inventory revised, which assesses a couple's interactions and the extent of couples' distress. This particular assessment provides scores for 13 subscales, such as affective communication, problem-solving communication, disagreement about finances, sexual dissatisfaction, and conflict over child rearing, as well as providing a global index or global distress scale. And the way that the marital satisfaction inventory is sort of administered is you have both partners or both members or all members of a marriage take the test. I will say that the marital satisfaction inventory is only used for 2 couple marriages, but you have both members of the marriage or of the partnership take the inventory separately. And then when they are done, the scores are combined for one single profile. And this approach allows you as a counselor to investigate the areas of agreement and disagreement between the couple. We also have the Derogatis Sexual Functioning Inventory, which is a popular measure for exploring sexual functioning that also provides information about sexual satisfaction within relationships. This particular assessment is intended to measure current functioning, although there are some scales within this assessment that will explore lifetime experiences. And even though we are often, and even now, talking about the Derogatis Sexual Functioning Inventory as being a couples assessment, it's really used to measure individual versus couple sexual satisfaction. So use caution because this assessment was also normed on white middle-class samples, so its generalizability outside of these demographics is extremely limited. And we also have the Prepare and Enrich, which are 2 parallel forms of a survey that explores relationship strengths and challenges with attention to communication patterns, family dynamics, and significant stressors. The survey includes 12 relationship scales and 5 scope personality scales. And scope in this case is an acronym that stands for social, change, organized, pleasing, and emotionally steady. You also will give the couple or family 4 family and couple scales and several customizable scales. So you really get to tailor this particular assessment to your client, which then makes it a little bit harder for us to talk about it because it is so variable depending on the population that you're using it in. We also have the Couples Pre-Counseling Inventory, which is a measure designed to evaluate couples in 12 relationship areas to aid in treatment planning in couples counseling. Some scale areas include communication assessment, conflict management, sexual interaction, child management, relationship change goals, general happiness with the relationship, and goals of counseling. And again, this particular inventory is used to determine when a client that is a couple comes in to receive counseling. This will tell you what you need to focus on in the therapy that you're doing together. We also have the Family Environment Scale, which assesses a family member's perception of its family as it is preferred to be, and as it is expected to react to new situations. And sample scales within the Family Environment Scale include things like cohesion, intellectual cultural orientation, active recreational orientation, religious moral emphasis, expressiveness, and control. And this skill can be used to explore differences between parents, from parents to one another, or from parents to children on their perceptions in each of these areas. And this then highlights the treatment areas for the family within counseling. The 10 scales of the family environment scale make up 3 larger domains, which include the family relationship domain, the personal growth domain, and the system maintenance growth change domain. So you really get this comprehensive view of family functioning with this assessment. We also have the Family Assessment Measure 3, which is used in family counseling to evaluate family strengths and challenges. Specifically, it evaluates general family functioning, how a family member perceives one another, as well as self-ratings of a family member's own functioning so that you get a perspective of someone's individual strengths and weaknesses, as well as how they perceive that coming into the family as a whole. And we have the Sternberg Triangular Love Scale measures, which addresses 3 components of relationships: intimacy, passion, and commitment. And according to Sternberg, all 3 components must be assessed in evaluating the quality of a romantic relationship, which is the primary purpose for this assessment. It's all about looking at the quality of a romantic relationship based on intimacy, passion, and commitment to the relationship. And then finally, we have the Dyadic Adjustment Scale, which is designed to assess the quality of interpersonal adjustment in couples. And it contains 4 subscales that evaluate the degree of cohesion, satisfaction, and emotional expression within the dynamic of the couple. So those are the primary scales that we use with couples and family. And as you can see with previous chapters, there's a wide variety depending on what you're presenting, like what the client's presenting concerns are. I do think it's really interesting that a lot of times as clinicians, we don't always use these assessments because we do rely on those informal assessments. But there is utility in using these standardized assessments of couples and families because sometimes couples want the experience, the intervention of doing an assessment so that they can see written out where the disagreements are, where the conflict is coming up, why they're in therapy, because they know that something's wrong, but they might not always have the words to describe it. So the use of assessments in these circumstances can be a form of intervention in the work that you're doing with a couple or with a family. So switching gears entirely, I want to talk a little bit about assessments of interpersonal violence or intimate partner violence, because intimate partner violence is defined as the actual or threatened physical, emotional, and or sexual abuse against a partner by another partner in a romantic relationship. IPV is predominantly reported by individuals who identify as women, with 30% of women reporting IPV during their lifetimes. And women with multiple minoritized statuses encounter more pronounced consequences given discrimination experiences as well as limited resources due to those minoritized identities. And it's important to note as well that although the research has shown this, not every study that is investigating IPV has collected identity information on the person causing harm, which then sort of leads to some stereotypes and some assumptions about the identities of people perpetrating intimate partner violence. So just keep that in mind when you are taking in information about IPV. And research tends to show that there's a heterosexual bias towards couples reporting IPV, in which each partner in a same-sex relationship tends to be blamed equally by clinicians as compared to male-female violence, in which each partner is not blamed equally. In fact, the individuals who were assigned male at birth tend to be blamed more often in those circumstances. And this bias is exacerbated by the notion that there may be a lack of understanding of IPV among couples and families of diverse backgrounds, including sexually diverse backgrounds. There's also limited community support for non-traditional couples and an underreporting of the incidence and prevalence of IPV amongst diverse populations. So keep that in mind when you are hearing stats about IPV so that you can make informed decisions about the way that you interact with your clients. And right now, it's estimated that approximately, as I mentioned, 30% of women will experience IPV in their lifetimes. And I have a little bit more of a breakdown here in that 61% to over 80% of adolescents between the ages of 13 and 17 report experiencing incidents of emotional abuse in their lifetime. And then, as I already mentioned, there is that heterosexual bias in intimate partner violence counseling. So, we're going to talk a little bit about what assessment of interpersonal violence looks like. And really, this particular section of our lecture is not intended to say, here, if you have a couple or you have a person who's coming into you and is experiencing these things, here are specific standardized assessments that you can use. That's not what this is intended to be. Rather, a lot of times our work as counselors can include assessments of IPV informally. And there are some things that we can do to improve our efficacy as well as our efficiency in gathering that information. And there are some effective practices that we can engage in to help streamline that process while also being critical consumers of this information, as we've already highlighted. So there is a little bit of a background, and I threw all of these up on the screen already because I think it's important for us to think about these things in combination with one another. Our book highlights the effective practices of doing an IPV assessment, and those include things like using a variety of assessment tools. So, using individual interviews, maybe having the person fill out answer sheets, or maybe it is doing some behavioral observation. Combining all of those assessment tools and using various assessments to assess for IPV is going to be really helpful. You also want to make sure that when you are talking with someone about intimate partner violence, that you're assessing their current and their past experiences with IPV, as well as looking at it across various relationships. And the purpose with this is that you're looking for patterns. You want to see if this is showing up in multiple areas of their lives, or if this is something that you need to focus a discussion in a particular area. You also want to make sure that you're always assessing for family violence and the impact of it in the client's life. You want to ask as well about a client's experience being the offender to gauge risk level for engaging in these behaviors. You always want to provide your clients with a comprehensive list of resources, even if they don't ask for them, but doing so in a mindful way, recognizing how the list of resources could be a harm or a danger to the person who's receiving them if someone else sees them. So providing them in a way that is comprehensive, yet is not going to cause more harm to the person who's asking for help and who's seeking help. You also want to ask about available support systems and see if those are available for you and for your client to make sure that this person is safe. You also want to use culturally appropriate assessment measures, so adapting your measures based on the client's identities. And you want to combine your assessment with preventative measures. So look for things in the client's life that will help prevent them. So use screening tools, use psychoeducation, whatever it is, incorporating all of these in a way that is going to best assess your client and best support them. You can see more about these tips in our textbook, but I wanted to highlight some of these because I do think it's important in our best practices of assessing intimate partner violence. So also, as counselors, if we are talking about intimate partner violence assessments, we can't go very far without also acknowledging the limitations of these assessments. And counselors are aware of these limitations today, and some of those include that a lot of assessments of intimate partner violence are very limited in the type of relationships that they're assessing. They're only assessing intimate partnered relationships and not other types of intimate relationships that come up. There's also a predominance of emotional and physical abuse being evaluated in these assessments compared to sexual abuse. There is also a limited measure of imminent risk factors for our clients. So it's really difficult for us as clinicians to assess imminent risk with these inventories, and that's where those informal measures and best practices will come into play. There's also minimal evaluation of the family dynamics and the roles of perpetuating IPV. There's also in these assessment inventories inattention to the available support networks that are available to our clients, which is where we really need to focus on that ourselves. Also, most IPV assessments lack scoring information or flexible item response options, so that we might not always be capturing our client's experience with IPV most effectively. And there's limited reliability and validity information on these IPV assessments, which means that we need to use them with caution with our clients. And in addition to those 7 themes and related limitations, there are several global limitations of IPV assessments. Namely, IPV assessments may not provide equal attention to all IPV forms within an assessment itself, and there's a lack of attention to the degree of the severity of abuse, as well as generally, IPV assessments do not generally acknowledge the frequency of abuse, which is important in us determining risk. And these tools do not adequately screen for IPV as effectively as we need them to. And there are problems with the item formats, as we've already identified, as well as in including things like vague question answer responses and double-barreled questions that can provide confusion for clients. And these assessments oftentimes contain cultural bias. So it's important for us as counselors to evaluate how individuals in the room with us conceptualize IPV, to what extent IPV has been a part of their current and past romantic and family relationships, what supports they have, and what data from multiple assessment sources will tell us as clinicians about our clients' current situations. We really have to evaluate all of these things if we want to get a complete picture of IPV for our clients. So that's where we're going to wrap up part 1 of our lecture on chapter 14. Join me for the second part of our lecture where we're going to talk a little bit about some additional specific assessments within family and couples. I will see you all in the next lecture.